Early detection of breast cancer can be done by mammography, thermography. False answers are digital X-ray, FNAC, excision biopsy. Screening for breast cancer: breast self-examination, BSE, palpation by a physician, thermography, mammography. Modifiable risk factors of non-communicable diseases include tobacco inhalation, inheritance, physical inactivity. Stress. Early detection of breast cancer can be done by mammography, thermography. False answers: digital X-ray, FNAC, excision biopsy. Screening for breast cancer: breast self-examination, BSE, palpation by a physician, thermography, mammography. Modifiable risk factors of non-communicable diseases include tobacco inhalation, physical inactivity, stress. False answers are inheritance, ethnicity. Details: risk factors of NCD: cigarette use and other forms of smoking, alcohol abuse, failure or inability to obtain preventive health services, example HTN control, cancer detection, management of diabetes, lifestyle change, dietary pattern, physical activity. Environmental risk factors: occupational hazard, air and water pollution, and possession of destructive weapons. Stress factor. Risk factor for heart related illnesses are age greater than 65 years, obesity, heart and lung diseases. False answers: low socio-economic status, rural residing. Details: non-modifiable factors: age increase with age, sex more in female, family history, genetic factors, personality. Modifiable factors: cigarette smoking, high BP, elevated serum cholesterol, diabetes, obesity, sedentary habit, stress, hemostatic variables, dietary deficiency of antioxidant, vitamins, and polyunsaturated fatty acids. Modifiable risk factors for coronary heart diseases are obesity, physical inactivity. False answers: age, ethnicity, personality. Examples of non-communicable diseases are diabetes mellitus, coronary heart disease. False answers: malnutrition, AIDS, measles. Common chronic non-communicable disease: cardiovascular disease, coronary heart disease, hypertension, stroke, rheumatic heart disease, cancer, diabetes mellitus, obesity, blindness, accidents and injuries. Characteristics of non-communicable diseases are long incubation period, multifactorial causation, irreversible pathological change. False answers: definite onset, defined etiological agent. Cardinal characteristics of non-communicable disease: they are permanent, they leave residual disability, they are caused by non-reversible pathological alteration, they require special training of the patient for rehabilitation, they may be expected to require a long period of supervision, observation or care. The following are the modifiable risk factors of coronary heart disease: moderate alcohol intake, dyslipidemia, obesity. False answer: genetic factor, older age. Chronic non-communicable diseases. Answer: do not have biological agent but have risk factors, are caused by non-reversible pathological alteration, have multifactorial causation and long latent period. False answers: expected to require a short period of supervision, observation and care, may be cured completely with appropriate treatment and care. High risk population for diabetes mellitus. Persons having diabetes in their family, people who eat more but do not do physical work. False answers: people who are not fully vaccinated, people who do excessive physical work, people suffering from repeated infection. The following occupations have been associated with high risk of cancer. Answer: coal mine, nickel worker, asbestos worker, beryllium worker, tobacco industry. The major killer diseases are myocardial infarction, stroke, cancers. The major killer diseases are myocardial infarction, stroke, cancers. False answer: diabetes mellitus, panic attack. Non-communicable diseases are diabetes mellitus, malnutrition, schizophrenia. False answer: AIDS, sexually transmitted infection, STI. Some important terms: vital event, live birth, death, fetal death, marriage, divorce, adoption, legitimation, recognition, annulment, legal separation. Vital statistics: birth rate, death rate, fertility, life expectancy at birth, mortality, natural growth rate. Demographic process: birth, death, marriage, migration, social mobility. Demography and family planning. Vital events are: answer marriage, birth. False answers employment, migration, mobility. Details: vital event live birth, death, fetal death, marriage, divorce, adoption, legitimation, recognition, annulment, legal separation. Reproductive health care is provided in the community by home visit by FWA community clinic, Upazila Health Complex, Union Sub-Center. False answer rural dispensary. An emergency contraceptive method is a temporary method, ideal method for preventing unwanted pregnancy, available in the market. False answers: ideal method for birth control, barrier method. 4 methods of emergency contraception are: ECP containing ulipristal acetate UPA, ECP containing levonorgestrel LNG, combined oral contraceptive pills, copper bearing intrauterine devices. Abstinence may cause repression of a natural force, nervous breakdown, temperamental change. False answer: high contraception failure rate, natural birth control. Natural birth control method: breastfeeding, withdrawal, basal body temperature. Breastfeeding is contraindicated when mother suffers from answer HIV, active tuberculosis, septicemia. HIV, active tuberculosis, septicemia. False answer: viral hepatitis, ovarian cancer. Contraindication of breastfeeding: in mother, serious psychiatric problem, inverted nipple, fissure, cracks, acute fever, TB, kidney disease, breast abscess, septicemia, breast tumor. In children, galactosemia. Absolute contraindication: phenylketonuria, gross prematurity. Determinants of high fertility rate: early marriage, poor living condition, low literacy rate. False answers: poor health facility, high population density. Factors for high fertility rate: universality of marriage, early puberty, low standard of living, low level of literacy, traditional customs and habit, absence of family planning habit, absence of entertainment, religion, multiple marriage, breastfeeding, place of women in the society. Ideal candidate for intrauterine contraceptive device should have regular menstrual cycle, access to follow-up, Willingness to check the tail of IUCD. False answer. At least 2 children. Polygamous relationship. Help link the ideal IUCD candidate who has born at least one child, has no history of pelvic diseases, has normal menstrual periods, is willing to check the IUD tail, has access to follow-up and treatment of potential problems, is in a monogamous relationship. Pillars of safe motherhood are family planning, antenatal care, essential obstetric care. False answer. Vaccination, women's empowerment. Pillars of safe motherhood: family planning, antenatal care, obstetric care, postnatal care, post-abortion care, sexually transmitted disease or HIV control. Base: communication for behavior change, primary health care, equity and education for women. Demographic process includes mortality, migration, social mobility. False answer. Morbidity, divorce. Demographic process include fertility, mortality, marriage, migration, social mobility. Modes of action of IUCD are: acts as a foreign body, alter cervical mucus, affect sperm motility. False answer. Prevent ovulation, stimulate LH surge. Mechanism of IUCD: cause foreign body reaction causing cellular biochemical change. In the endometrium and uterine fluids. Cause foreign body reaction causing cellular and biochemical changes in the endometrium and uterine fluids, impair the viability of the gamete, reduces its chance of fertilization rather than implantation. Absolute contraindication of OCP Absolute contraindications of OCP include congenital hyperlipidemia, thromboembolism, cardiac abnormality. False answers. Migraine, gallbladder disease. Absolute contraindication of OCP: cancer of the breast and genitals, liver disease, previous or present history of thromboembolism, cardiac abnormality, congenital hyperlipidemia, undiagnosed abnormal uterine bleeding. Breastfeeding is contraindicated when mother is HIV positive, mothers receiving chemotherapeutic agents. False answers. Mother is suffering from hepatitis B virus, baby born with jaundice, baby born with low birth weight. Male sterility is related to orchitis, undescended testis. False answers: viral hepatitis B, poliomyelitis, tetanus. Details: 4 main cause of infertility: hypothalamic or pituitary disorder, hypothalamic or pituitary disorder, gonad disorder, orchitis, undescended testes, sperm transport disorder, unknown cause. Vital statistics include birth, marriage, death. False answer: migration, social mobility. Vital statistics deals with data on the vital events in human life such as natality, morbidity, mortality, fertility, marriage, divorce. Vital statistics include indicators such as birth rate, death rate, natural growth rate, life expectancy at birth, mortality, fertility rate. An ideal contraceptive method. An ideal contraceptive should not be irreversible, costly for target people. False answer: user friendly, effective with least side effects, easily available. Features of ideal contraceptive: effective, safe and free from any side effect, acceptable to all, inexpensive and easy to access, simple to administer.